I will show you a still point induction on the sacrum. So first of all, I need to get under the sacrum, so I can use the sheet, or I can put my hand under the sheet. And the position should be comfortable for the client. And now, like a therapist or practitioner, I'm trying to feel the rhythm, which means movement towards the feet is flexion, and movement towards the head is extension. So try to be very gentle and try to listen. How is the rhythm of the client or patient? And still point induction means that I'm following the rhythm into the extension. Then is a break or pause, and I will try to switch off the radio in my head of listening of flexion, or I'm putting a small resistance against flexion. So then you can feel how the rhythm stops, and afterwards is going into the extension again. So you are following into other extension, the rhythm. And you don't listen the rhythm into the flexion again, it means that you put a small resistance against it. And you are doing so many times, how many times it's important for the rhythm to stop. So still point means that the rhythm is not moving into the flexion and extension. And the patient or client is in still point. So you can't feel any craniosacral rhythm or pulse on the body, which can be also feedback for you. And now she's in still point, so I can be here in this position for 1 minute or 5 minutes, or I can feel the resistance which is growing in the body, the tension is growing, so then I'm releasing my resistance, and afterwards I'm listening the rhythm again, which should be different than before. It can be more symmetrical, it can be more deeper, or whatever. Also the rhythm can stop for a little bit, so you don't need to feel the rhythm immediately afterwards. So this is the still point on the sacrum. Okay. So the other position of still point will be on the head. So I can show you how to put your hands under the head. So you can use your thumbs, and then you are moving with your thumbs above the ceiling, and you put the other fingers in the right position. And your thumbs should be on the occiput, not on the temporal bone, which means immediately under their ear. It's wrong position because you're on different bone. So you can try thumbs. She's helping me. So I think that I'm in a good position. I'm in the middle of the occiput. I'm trying to relax my thumbs and fingers. So you don't see nothing else, only I can show you this position, because the other work is very small and fragile. It means that I'm again listening, craniosacral rhythm, then I'm following the rhythm into the extension, which means narrowing the thumbs, my thumbs. Then I am inducing still point, which means that I can't feel any rhythm, any movement. And the last portion of the treatment is listening of craniosacral rhythm. So you can try it. And this still point induction is called CB4. It's compression of the fourth ventricle.